right, welcome back. Dr. Bob Cassidy joins us every week to answer your medical questions.
Yes,
Dr. Bob, thanks for
Good
being
to see
here.
you guys.
Yes,
Glad to
same
be here.
Is this the first time we've both been here with the doctor?
I think so, right?
All
The new
right.
trio.
You ready?
I'm ready to go.
Here
All
we
right.
go. We got the first question coming in from Patty, of course. How long does it take to get through shingles? She says, I am on week 3 and still feeling pain and burning sensations.
Patty, so shingles is a reactivation of the chickenpox virus, which we call varicella, and it usually happens in adults. And what can happen is you can have pretty intense pain, and then that's often followed by a rash that's red. There may be some blisters. The pain can be really bad. You know, some people will come to the emergency room, think they're having a heart attack, and they're just getting shingles along their chest. So after you get the initial pain, usually within 7 to 10 days, the rash is going to start to kind of scab over and then go away over the next week or so. You can have some pain really for days to weeks afterwards. Some people even end up with chronic pain. So that kind of shift is around a few months when we know whether it's going to be there longer term or not. So stick with it. Most people do get better, but you may have some pain for a little while longer.
All right, and Chris asks, if you lost your sense of taste because of COVID, will you ever get it back? It's been years for me at this point.
Yeah, Chris, unfortunately, this is not an uncommon story. So most people who've had COVID probably remember some change in their taste or smell. For the vast majority of people, when the symptoms of the cold go away along with COVID, you know, your taste and smell come back fine. For some people, unfortunately, it just doesn't. They may have odd sensations when they're tasting or their smell might be off. We really just don't know what's going to happen really at this point. I mean, it's an evolving area of research, so certainly something you should discuss with your doctor. There are some academic centers like Cleveland Clinic, which are doing some more cutting-edge treatments for this, but still kind of an evolving question.
I don't think I need to remind you, but during the pandemic, we had Dr. Bob on, I think, every day to answer questions, and it was constantly evolving.
Yeah, when I had COVID, I lost
Flashbacks.
my taste. That's flashbacks.
That's a flash. That just brought me back to a weird time.
I'm told we have video. No, we don't have video. Okay, we got another question here. RSV vaccines for older adults out there will be available this fall. It's what we're hearing from the CDC. So should we get this along with COVID and flu shots? That is a question from Josh.
So RSV stands for respiratory syncytial virus. It's a virus like many other common cold viruses. Many of us probably get this every year. We get sniffles, sore throat, and then it goes away. We usually talk about RSV in children because they can get difficulty with breathing if they get the RSV infection. But more and more in recent years, we've realized older adults can get severely ill from RSV, end up in the hospital. You know, some people may even pass away from it. So vaccines have been rolled out. There's a couple of them that are available. The studies that were done demonstrate that they reduce the risk of getting a symptomatic infection with RSV. There isn't as much research yet to show whether they reduce the risk of hospitalization or severe complications from RSV, though. So I still think this is probably an area where you should sit down with your doctor, discuss your medical conditions, and decide if it's right for you.
All right, good stuff. Dr. Bob, we appreciate it as
Good.
always.
Yeah.
What helps when you have like something in your throat during a show and you have to have your co-anchor hit you in the back? Like, is it hot tea?
Hot tea with some honey.
Honey.
Yeah, maybe burping too.
Just like a child.
Oh boy. All right, Dr. Bob,
We
thank you.
appreciate you being here. By the way, if you have a question for Dr. Bob, send us it on Facebook, email, whatever works.
Okay, we'll be right back. Stay there.